fund, and there's been it's been a major run by the government trying to make sure that we have a transition from NHIF to SHIF. Things are not. We're looking at the story of a mother of three, where at the Kenyatta National Hospital, Nanjira, a mother of three, had been relying on NHIF and went into labor at 12:20 a.m. 20 minutes after SHA, that is Social Health Authority, yes. Social Health Authority, had actually just was actually born, and she cannot afford to pay and is currently being detained until she pays out of.
That's right. That's just one of the question that was across the country as we moved from at the Jaramogi Oginga Odinga Teaching and Referral Hospital. Patients were stranded. Hospital staff who assisted resulted in and patients. The facilities were not able to theater procedures. Patients started to wait check with the hospital today. Procedures might be very time sensitive. So imagine being asked to wait. The cases in Siaya, example, where Miss Jane Atieno, who is a businesswoman and a mother of a child living with sickle cell anemia, was extremely worried because her son has been relying on NHIF costs, and she wonders, will the new cover be similar to the one we have? She said she's already registered for the Social Health Insurance Fund, but she doesn't know anything about it. So is her covered? Are his treatments covered? Does she have to register him afresh as well? There's so many questions, especially for people with chronic illnesses and for anyone who is in any hospital, any public hospital right now, even private ones.
And imagine walking into a hospital, Mariam, and you're told, you know what, that NHIF card is not now functioning. What happened to grace period, 2 weeks, 3 weeks to a month of trying to make sure that at least for those who have or need immediate medical care can be taken good care of? For example, in Moranga, Mr. Evans Manyeki, who's 72 years old, often goes to the hospital on a monthly basis to get medication for mental illness, worth only 100 shillings, and using the NHIF card. And he was turned away yesterday and told that he needs to register afresh. First of all, a 72-year-old man is not tech savvy, and if even if they're supposed to use their phone, maybe they don't even use their phone as much.
That's very
and now
true.
it becomes a problem because we're going to see the loss of lives, or actually health deteriorating. Our fathers, mothers, children who are going through chronic diseases, they need immediate medical attention.
On the court side of things, the High Court declined to suspend the rollout of Shif, which was launched by the government yesterday. Instead, Justice Bahati Mwamuye certified that a petition by Okiya Omtata, who is the Busia senator, and 2 others is urgent and scheduled the case for mention on Wednesday next week. So Okiya Omtata and the other 2 in this case had sought a temporary order suspending the rollout of Shif because they say that the prerequisite legislation for this Social Health Authority and the Social Health Insurance Act, Social Insurance Health Act actually, have not been implemented and have not been legislated, so we can't have a rollout of it. But for now, the court says we can continue as we wait for the hearing next Wednesday.
And as we do that, there is a lot of discrimination as well. I mean, look at a situation in Taita Taveta County, where administrators at a private hospital, that they were only accepting civil servants to be treated under the new insurance cover. What if you're not a civil servant?